This is 7 National News, and in our top story, the UAE President, His Highness Sheikh Khalifa bin Zayed Al Nahyan, has approved the release of 1,010 prisoners on the occasion of the holy month of Ramadan. According to official reports, those found eligible for release due to their good behavior have been sentenced in different cases and are being freed as kindness of the President in order to give them an opportunity to start a new life and bring joy to their families. The UAE Vice President, Prime Minister and ruler of Dubai, His Highness Sheikh Mohammed bin Rashid Al Maktoum, has headed the UAE delegation at the 16th Consultative Meeting of GCC leaders in Saudi Arabia. The meeting was chaired by the custodian of the two holy mosques, King Salman bin Abdulaziz Al Saud of Saudi Arabia, in presence of the UAE Vice President and their Highnesses, Kings and leaders of GCC countries, and also included a high-level UAE delegation which included the UAE Foreign Minister, His Highness Sheikh Abdullah bin Zayed Al Nahyan. At the conclusion of the meeting, the GCC Secretary-General Abdul Latif Al-Zayani said that the GCC leaders have approved the formation of a high-level body among the member states called the Commission of Economic and Developmental Affairs, which aims at enhancing the integration and coordination among the GCC countries in all economic and development fields and accelerate the pace of joint action. The Roads and Transport Authority has announced the timings for its transportation and customer services during the holy month of Ramadan. The agency has announced that its customer service centres at Omar Ramul, Barsha, Dera and Karama centres will open from 9 a.m. to 2 p.m. At-Tawar, Al-Manara and Al-Awir centres will open from 9 a.m. to 5 p.m. and the Jumeirah centre will open from 10 a.m. to 3 p.m. Fees in all car parks coded A, B, C, D and G will be activated from 8 a.m. to 10 p.m. from Saturday to Thursday. Code E fares are applicable to the fish market parking lot daily from 8 a.m. to 11 p.m. and Code F fares are applicable to the parking in Dubai Media City, Dubai Internet City and Knowledge Village from 6 a.m. to 8 p.m. The fare would be applicable daily around the clock to the multi-level parking buildings. Bus services running during the month of Ramadan from the main stations at the Gold Souq and Ghubaiba start at 5 a.m. and end at 12 midnight. In subsidiary stations such as Al Ghasais, the service operates from 5:15 a.m. to 12 midnight, and route CO1 from Satwa station is operational around the clock. Jabal Ali station operates buses from 5:30 a.m. to 10:30 p.m. and Al Quoz Industrial Area Station will operate from 5:15 a.m. to 12 midnight. Metro feeder stations including Rashidiyya, Mall of the Emirates, Ibn Battuta, Burj Khalifa Dubai Mall, Abu Hail and Etisalat stations will start at 5:15 a.m. and close at 12:30 a.m. from Saturday to Wednesday, and from 5:15 a.m. to 1:10 a.m. on Thursday, and on Friday from 9:30 a.m. to 10 past 1 in the morning. All stations on the Red Line will be open from Saturday to Wednesday from 5:30 a.m. to 12 a.m. On Thursday, the service is from 5:30 a.m. to 1 a.m. and on Friday from 10 a.m. to 1 a.m. All stations on the Green Line open from Saturday to Wednesday from 5:50 a.m. to 12 midnight, on Thursday from 5:50 a.m. to 1 a.m. and on Friday from 10 a.m. to 1 a.m. The Dubai Tram will offer services from Saturday to Thursday starting from 6:30 a.m. up to 1 a.m. and Friday from 9 a.m. to 1 a.m., while water buses at the marina stations will operate from noon to midnight. Water taxi services at the marina station will run from 2 p.m. to 10 p.m. at Al Ghubaiba station from 4 p.m. to 10 p.m. at the Palm Jumeirah Atlantis area from 4 p.m. to 10 p.m. and at Jumeirah Rixos Palm from 11 a.m. to 5 p.m. Dubai ferries from Al Ghubaiba station will be from 11 a.m. and 6:30 p.m. and from the Marina station at 11 a.m., 5 p.m. and 6:30 p.m. The Dubai Health Authority has released the findings of its second Dubai Health Survey, which revealed that heart disease is responsible for 30% of all deaths that occur in the UAE. The survey, which was first conducted in 2009, is commissioned by the DHA in partnership with the Dubai Statistics Centre and was conducted on 3,298 Emirati and expat families in 2014. The survey included Dubai residents from all nationalities and ages in an effort to learn both about social and health conditions. When surveying the families about the health and nutrition, 3.5% were found to suffer from hypertension, and more women suffered from the diseases at 5.1% than men at 3.2%. Out of the Emiratis surveyed, the study found that 18.9% of Emiratis suffer from hypertension, out of which 20% were men and 18% are women. Meanwhile, the survey found that more Emirati men have high cholesterol at 19.8% compared to women at 18.5%. The total number of Emiratis who suffer from high cholesterol was to be found at 19.1%. The opposite was true with non-Emiratis, as it was found that 6.6% of non-Emirati women suffered from hypertension than with non-Emirati men at 3.9%. The survey revealed that 21.9% of the people were smokers, 24.8% men and 4.2% women. When it came to fruit and vegetable intake, 50.5% said they eat fruits once every day and 29.9% said they eat fruits twice a day, while 42.7% eat vegetables once a day and 32.2% said they eat vegetables twice a day. The survey also found that 36.1% of the people surveyed suffered from borderline obesity, while 11.9% were obese. According to health officials, the DHA's aim in conducting this survey is to provide an accessible, effective and integrated healthcare system, protect public health and improve the quality of life within the Emirate. And the UAE Ministry of Health and Prevention has announced the launch of the Circle of Care campaign aimed at improving the well-being of UAE residents who may be at the risk of developing or living with type 2 diabetes. Unveiling more details about the campaign, slated to begin from the 6th of June this year in Dubai today, representatives from the UAE Ministry of Health and Prevention stated that their goal is to decrease the diabetes comparative prevalence in the country from 19.3% reported last year to 16.28% by 2021, complementing the UAE vision. Commenting on the findings from a recent local diabetes report undertaken by Project Hope, a global health organization, officials highlighted that there is a need for patients to receive support and education on managing their diabetes prior to and during Ramadan, and this campaign is timed perfectly to help both Emirati citizens and local expats to modify their lifestyle and eating habits during the holy month. Recent studies in the UAE suggest that the prevalence of type 2 diabetes in the age group of 40 to 60 is nearly 30%, while in the age group of 20 to 39 it is close to 7% of the adult population. The Circle of Care campaign will be implemented in a series of phases starting from the 6th of June this year, and it was informed that the first phase of the initiative will particularly focus on Emirati diabetic patients, with the aim of decreasing adverse outcomes of diabetic patients during Ramadan.
The Ministry is taking this initiative as a part of from the strategic points of the national agenda of UAE National Agenda 2021 to reduce the diabetes patients percentage. It will focus not only on the patient, also for the food which they are taking. And this initiation will be in 3 languages, Arabic, English and Urdu also, because we have Urdu patients who cannot speak English or speak Arabic. So it will be for them as an announcement.
As you know, diabetes is an epidemic worldwide, and the case is not different in Emirates. We have, according to the IDF, International Diabetic Federation 2016 Atlas, that we have 18.7% of our population are diabetic, and we have similar amounts who are pre-diabetic. The cornerstone in management of chronic disease is patient education. And the Circle of Care and the Project Hope is aimed at patient education, not only patient education, but increase again the standards of healthcare providers. And when I'm talking about healthcare providers, I'm talking about the multidisciplinary team. And the multidisciplinary team approach in management of diabetes is the cornerstone in management. And the best results always comes when you manage diabetes through a team.
We went back in collaboration with the Ministry of Health, and we focus on 3 areas with the Emirates Diabetes Society, focusing on uplifting health care professional management of diabetes. Second, having more patient education to build self-management with a caregiver as well in diabetes. Third, health authority to increase the awareness and the diagnosis of the disease. Now, to do that, we prepared a set of materials. This material will help the education to the patient. Will be able, through seeing a video showing the disease of diabetes, the identification, the diagnosis, and will be broadcasted either in a local TV network or through clinics.
Food safety inspectors have found unacceptable levels of pesticides and dangerous chemicals in some fruit and vegetables imported from India. According to local reports, exporters in India have now been ordered to carry out new pesticide residue tests on their produce before it can be approved for sale in the UAE. The new rules follow inspections by the Ministry for Climate Change and Environment, while India's Agricultural Export Development Authority has reportedly stated that it had been told by the ministry that Indian produce had levels of pesticide that exceeded permitted limits in accordance with international standards. Those standards are set by the food regulatory body for the United Nations and World Health Organization. The authorities said the UAE had decided for the health and safety of consumers that the entry of chili, peppers, mangoes and cucumbers will not be allowed without a residue analysis report with each consignment. The UAE was one of the top 4 overseas markets for Indian fruit and vegetable from 2014 to last year, and the world's biggest importer of Indian mangoes and onions. Fruit and vegetable importers said shoppers should not be worried about the safety of produce here, as the new rules would ensure overseas farmers used only safe pesticides, while the ministry will continue to carry out checks at Jebel Ali port on consignments arriving in the country. And finally, in the bulletin, Emaar Entertainment has partnered with Discovery Consumer Products to open a new store that promotes the company's shared philosophy of valuing the practice of conservation and philanthropy while delivering experiences that inspire, entertain and educate. Located on the second floor of Dubai Aquarium and Underwater Zoo, the new Discovery Channel store is a first for the region, pushing the frontiers of innovation at several levels and offering a mix of merchandise and educational experiences, all with a message of conservation at its core. The storefront is suspended over an aquarium linked directly to Dubai Aquarium, offering a seamless integration of digital and reality where customers can enjoy footage from Discovery Channel, be entertained by further aquariums and browse the wide range of Discovery products and gifts, as well as Dubai Aquarium and Underwater Zoo merchandise. The products include a number of high-tech boys' toys for sale, such as a working 2-man submersible on the display at the heart of the shop, which is ideal for those who wish to explore the aquatic world. Additionally, the store offers a number of brands specifically chosen for their commendable efforts in supporting charities that promote environmental conservation and the wellness of human beings. According to officials, the new exciting initiative is an embodiment of one of Discovery's cult franchises, the now iconic Shark Week. Opening to the public in summer 2016, the new addition to Dubai Aquarium and Underwater Zoo will be the world's first official Discovery Shark Week exhibit, bringing the franchise to life and offering guests access to the underwater world of the sharks through a truly innovative and interactive experience.
So with the retail project, essentially what we wanted to do is make sure that we bring in a lot of charities and conservation projects. So if you look around the store and if you take the time to actually read the stories behind the products, you'll find that there's products there that support marine conservation, saving whales, saving turtles, and then there's also a lot of charity-based products there as well. So orphans who now make slippers and, a lot of stories, a lot of heartbreaking stories, and these are their products and they benefit from the sale of these products. So this is project one out of a number of projects, and each project is going to get a bit bigger and a bit more fantastic than the last. So certainly we know what the projects are ahead of us. We'll be revealing them one by one. They're not too far apart, and it's pretty exciting to look at the possibilities as to how we can come together.